This is Darren from Danger by Degrees. In this episode, we're going to talk about three things. One, what is a crisis? Two, we're going to talk about what kinds of crises can happen. And three, we're going to talk about why COVID-19 is a crisis. So join with me and let's talk about all things crisis. What is a crisis? Often you're going to hear things like, emergency, crisis, disaster. Generally what is meant by this is any situation or events that shatter your own sense of security. They are events that are unusual, are unexpected, out of the norm, and generally speaking create instability or negative consequences. They can be short-term, they can be long-term. They can be one or many factors. They can be, say, getting into a car crash, or they can be having the economy crash all around you and everybody is screwed. Effectively then, crises are events that are outside of your control, are unusual events that happen in the normal day-to-day activities that you do. What kinds of crises are out there? You can have a personal crisis, you can have a family crisis, you can have community crisis, a regional crisis, a national crisis, an international crisis. You can have business-wide crisis, you can have industry crises, you could have crisis in the government, you could have a crisis in the religion that you belong to. It all depends. So take you as a person. An example of a personal crisis would be, say, losing your wallet and having a bad case of identity theft. Someone takes your ID and all of your important documents and uses that to falsify using your name. They take and then carry out loans in your name and could end up causing a lot of trouble for your financial foundation. Say a regional crisis could be an impending flood. All these people now all of a sudden are living on a floodplain. They might need to evacuate. So all of a sudden the stability of going to home after a day's work is at question, because now you don't know if your home's going to be there when these floodwaters hit. You don't know how much damage is going to be done. National crises could be, say, if you're in a democracy, all of a sudden the government has been found to, say, commit a crime and is no longer legitimately able to govern. Well, the people might have to rise up in protest to effectively say the time is up for that government. An international crisis could be examples, say, when America is committed to protecting Taiwan. Well, if China ever attempts to invade Taiwan, America will come to Taiwan's defense. This could end up creating an international crisis because you have two countries that are now at war. And the Strait of Taiwan is also a major shipping point. It is a major transit route for ships. China is one of the world's largest economies now, number 2 just next to the United States. Taiwan is a major supplier of semiconductors and computer chips. Either of these two getting interrupted or disrupted would cause international recriminations. If you look at it, you can even have, say, like another example would be an industrial level crisis. Many years ago, there was a thriving fishing industry on the east coast of Canada for cod. But because of overfishing and government mismanagement, they all came together to effectively see that there was no more fish to fish. Whatever was left was needed to recover. And if people started fishing what was left, the cod might go completely extinct. So this, for instance, is a good example of crises and what kind of crises can exist. What makes COVID-19 a health crisis? Or why is COVID-19 now a crisis? Internationally, we've seen that some of the effects of COVID-19 include a run on the healthcare system, so the healthcare services and resources could be effectively overcome. So not only does the national healthcare safety net all of a sudden be compromised, but persons who say do not have COVID-19, such as those with chronic heart disease, people who have diabetes, are no longer able to be able to get to the hospital to get regular treatments. They're now having to wait and deal with their healthcare condition without any support, because there are so many people who are now draining the healthcare resources because they have COVID-19. COVID-19 is a very infectious agent. So now all of a sudden, COVID-19 can get into a country and infect large numbers of people, which makes things, say, like outdoor concerts, the way we like our lifestyle, can now be impacted. So, say if you, as a young, healthy person, get infected, you may just have mild to, say, a moderate cold. But say if you then go home and you have this virus and you spread it to your parents, you could possibly expose your parents to a fatal condition, being in the pneumonia. COVID-19 is creating a healthcare crisis, therefore, because it is something that could potentially overwhelm the resources that are available. It can also attack the people who are trying to provide the aid to us. So doctors, nurses, and so on could get themselves ill or be required to be quarantined if they're exposed to this virus for 14 to 21 to even longer days, which further drains the healthcare system because now there's less capable workers to provide healthcare. Healthcare workers, if they're exposed as well, could end up then spreading it unknowingly to other patients and could end up becoming another source of infection. COVID-19 could end up impacting supply chains. So not only could this now start impacting the economy, but it also could end up impacting where you work. It could impact, and has already impacted, the borders, so that all of a sudden, say a country like Canada or America or in the EU, China, ends up closing down large stretches of not only the economy, but also people are no longer able to travel, goods cannot move, and you end up creating a bottleneck where the economy stagnates, people are stagnating, and it can just end up pushing people into poverty. Why COVID-19 is a healthcare crisis. And a health crisis is that it can infect large numbers of people. It is deadlier than normal flu. It can cause a run on the healthcare services that require extensive resources to help people recover. It is impacting the weakest and the least healthy people, the least marginalized people. It is something that will normally go after the elderly, those with pre-existing health conditions. So that is why it's primarily a healthcare crisis, because it can impact, cause death, it can impact and cause large-scale runs on our healthcare services, but as a secondary and even tertiary impacts, it can now spread into the community much faster than, say, flu. It can end up creating impacts upon the greater society. It could end up as, say, a secondary kind of cause. It will impact everything from where you work to just the way that you live. A tertiary or third rate is that if, say, large numbers of people are now out of work, well, it could end up creating social instability because the safety nets and the tax systems that are used to support all those people, they're not working, no revenue is coming into the government, and you end up having a recipe for, say, large numbers of people out of work, staging strikes, ignoring the guidelines that have been imposed upon people to prevent this condition from getting worse. What is a crisis? A crisis, therefore, is anything unexpected, out of the norm, that disrupts our daily security, our daily safety net. Anything that can go wrong, will go wrong, that causes us to effectively not be in a stable position. That is a crisis. And what kind of crises have we seen? Well, we can see financial crisis, we can see personal crisis, we can see industry-wide crisis, we can see financial, we can see healthcare, and so on. And why is COVID-19 therefore a crisis? Well, it's affecting our daily stability. It's affected our economy. It's affected our social order. It's affected us in our supply chains. It's affected us in ways that we're only now starting to see. COVID-19 is primarily a healthcare crisis in that it's causing deaths, but it's also causing a social crisis because people are out of work. This is a multi-pronged, multifaceted, multi-issue crisis. Join me in the next video as we talk about the mechanics of COVID-19 and why and how and where this crisis is going. I'm Darren, and you're with Danger by Degrees.